Hey everyone, it's Dr. Taryn from Burlington Sports and Spine Clinic. Today I'm going to be going over a few different mobility drills with you guys for your hips and your ankles. So if you're like me, you've probably been sitting a little bit more than you usually are used to, just being in quarantine. So with that, with a lot of extra sitting, our hips kind of tend to stiffen up and feel a bit more tight. So as well as our ankles. So these mobility exercises will kind of help loosen things up a little bit, kind of get you moving better and feeling better. So the first one we're going to go over is called the 90-90, and this is a drill for your hips. So very easy, just like the name, we're going to get into a 90-90 position with the legs. So you're going to pick a lead leg. I'm going to pick my right leg for this drill here. So I'm going to bring that thigh out in front of me, and my knee and my leg are going to form this nice 90-degree angle in the front, okay? So you're up kind of nice and tall like this, shoulders back and down, chest up nice and tall, and same thing with the back leg. So with my back leg, I'm going to do the same thing. I'm going to make sure that my hips in line with my knee and my knees in line with my ankle, forming that nice 90-degree angle, okay? So my lead leg here is an external rotation and of the hip, and my trail leg is an internal rotation of the hip. So I'm working both at the same time. Being upright like this is a bit more of an advanced position. If you're struggling to get into this position or you have kind of pain or any pinching, what you can do, it's a bit more of a beginner position. You can go down on your forearm like this and just kind of have your hand on your hip like that. So this isn't as intense. If you do have really tight hips, this might be a good place to start. So I'm going to kind of go back into that more advanced position. And like I said, I'm going to keep my chest nice and tall, my shoulders back and down, and I'm going to try to almost even hover, kind of drawing my belly button forward a little bit. And with that, you'll feel an increased stretch already in the glutes, and you'll feel that external rotation in the hip as well. So with this drill, there's an active component. So with the active component, it's going to help even improve my external rotation and internal rotation on my back hip. So the active component's very easy. You're not going to see any movement, but it's the generating that force from the hip that's going to improve your mobility. So what we're going to do is with this lead leg, we're going to pretend to break the floor with the bottom part here of my leg. So again, you're not going to see any movement, but what you're going to think about doing is pushing your knee, your shin, and your foot and your ankle into the ground. So we're pushing downwards, okay? I find putting my hands together like this in a fist helps me generate a bit more force. So this is what it looks like. You're gonna hold it for 10 seconds and then slowly release, okay? So we're gonna get in that position. I'm kind of in that hover. I feel good. Chest nice and tall, shoulders back. And I'm going to push this part of my leg down into the floor. So we're gonna hold it for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And then I'm going to release, but I'm not going to move backwards. I'm actually going to sink a little bit further forward into that motion there. And then again, you're going to repeat that. So another 10 seconds, you're going to push into the ground for 10 seconds and then go a little bit further. And then from this position, you're going to do the exact opposite, okay? So what we're going to think about doing now is lifting this part of my leg upwards to the ceiling. And again, you're not going to see any movement, but I'm activating my hip muscles from a different kind of angle here, okay? So I'm going to lift up this part of my leg and lift up for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And then I'm going to relax, go a little bit further. And then one more time, I'm going to think about lifting this part of my leg up off the ground, okay? And then once I get into that kind of end range position after doing the 2 contractions down, 2 contractions up, I'm able to really kind of improve that external rotation of the hip, okay? And once I get here, I'm going to hold it for about 30 seconds. For the video's sake, I won't hold it the whole time, but you're going to be in this position. You'll feel a really nice release in that glute and this part of the hip here, okay? From this position, now work the internal rotation of the back hip, we're going to kind of come up nice and slowly. And if you can, I want you to try to square off your torso to this back thigh, okay? So I'm twisting like this now, I'm in this position, and we're gonna do the same thing. I'm gonna think about pushing the knee, the bottom part of my shin there, into the ground for 10 seconds. So you push, 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 10 seconds, relax. Another push, 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 10 seconds, and relax. And then what we're gonna do is try to lift that leg up to the ceiling, lift up, hold it for 10 seconds. Good. And then you'd relax, and another 10 seconds up to the ceiling. And then with doing those contractions, you'll be able to kind of sink back further onto this glute here, and you'll feel that increase in internal rotation of the back hip. So hip mobility is really important. A lot of the time, people who have low back pain, I always check their hips because sometimes a lack of hip mobility can cause back pain. So it's very important to work on your hip mobility to prevent or reduce your risk for any back pain in the future.